Get on up.
Everybody right there.
Get into it.
Everybody right there.
Get involved.
Everybody just come on up. Come on up. Come on.
Hello, it's Sam Magavern from Partnership for the Public Good here on our Public Good video segment. And today with us we have Jessica Bauer-Walker and Sherman Webb. They're with the Community Health Worker Network of Buffalo, and we're asking them about school wellness in the Buffalo Public Schools, and in particular about a district wellness policy that's going to be up for a vote soon. So Jessica and Sherman, what is the Buffalo Public Schools district wellness policy?
So the district wellness policy is a Board of Education policy that was instituted first in 2012, and it really brings together all the different aspects of health and wellness for students. So we're not just talking about physical health and nutrition, although that's included. We're talking about mental, emotional, and social health, building level climate, environmental health, staff wellness. So it's this very holistic model that talks about the whole child framework of what students and families need to be healthy and safe and supported in schools.
And also within that whole child model, there's room and space for implementation from the community to come in and do programming and offer a lot of support. However, a little bit of that has been lacking, and there's a great opportunity for more engagement from the community in order to really achieve that whole child, whole community, whole school idea, which the Buffalo Public Schools has put out there.
So the district already has a wellness policy, but there's some changes to it that you'd like to see made, and those are coming up for a vote soon. So what are the most important ways that the wellness policy should be changed?
This really expands the initial framework, builds it out further into that approach that Sherman just spoke to, this whole child, whole school, whole community type of model. So it's expanded and updated, and including a stronger component on things like family, community involvement. It's breaking them out and really playing unique roles for families separate from community. Also talking about counseling and psychological services separate from social and emotional climate. And those things that really I think a lot of folks could and organizations could do to build building level climate. So just a little bit expanded, more holistic, more aligned with some of the new state and federal regulations to make education more holistic.
And having had a little bit of experience within some of the Buffalo Public Schools, it's a high-stress environment, and there's an opportunity to allow people from the community who can be trained through the Community Health Network of Buffalo in order to be community health workers within buildings to offer support to these teachers and administrators who oftentimes get stressed with the demands of their jobs. And then within the policy, there are minimal time allotments for physical activity, and in my personal opinion, I feel as though they should add another 10 or 20 minutes into the day, that's structure for physical activity, even if it's just getting the children up out of their seat and engaging in some sort of activity which gets their mind stimulated, because science supports the theory that physical activity improves brain health. So that's something that we feel is also a strong opportunity within the wellness policy.
Yeah, as you two work with Buffalo Public School students, and I know you both have a lot of experience with this, what are some of the biggest health issues and challenges that you see that the students are facing right now?
Lots of different health issues. We've been struggling with things like really high rates of obesity. That's one of the reasons we've really advocated for physical education and recess, and just more movement in general, and healthier foods. More healthy, whole, culturally appropriate foods is something that we have continued to advocate for as well. We do data every couple of years with a youth risk behavior survey, which is a Center for Disease Control and Prevention tool. And what we're seeing in addition to those, real hard health indicators is things like social and emotional well-being is a huge need, and we need to think about issues that our students and families are facing related to mental health, related to trauma, related to stress on a bunch of different levels. And we're seeing data that really reflects high rates of things like depression, suicide attempts, community and domestic violence, and things like that that need to be addressed.
Yes.
Go ahead.
A lot of our students and families are experiencing complex trauma and have been experiencing complex trauma And when things aren't really settled or addressed within the community on the community level, a lot of that spills into the school, and that influences the child's ability to perform academically as well. And so by offering those supports within the community and then allowing those community supports to kind of come into the school to really achieve that whole child, whole model is really something that I'm advocating for as well.
Great. So if students, parents, community members want to get involved in helping pass this revised district wellness policy, what should they do?
We are going to be at the Board of Education meeting on Tuesday, June 20th. It's going to be at Waterfront School, which is right behind City Hall. Starting at 5 o'clock, we'll be having a press conference, and then at 5:30, we're going to the Board of Education meeting. Sherman and I will both be speaking at the meeting on behalf of families in the community. If folks would like to speak at the board meeting, they can call the Board of Education office at 816-3567.
Yes, and then also you can go onto the Board of Education's website and you can leave a comment on the school wellness policy if you're unable to attend the Board of Education meeting on the 20th. So there's multiple opportunities for you to become involved. And also, if you're a parent or student or a concerned community member who has opportunities and resources and a desire to work with young people and families, you can join school wellness teams and just reach out to different school administrators to see what ways that you can get involved.
Great. So for the real short version of the message, it's people should say they support the proposed changes to the district wellness policy. Is that right?
Absolutely. So
Yes.
you can even, as simple as going on the Buffalo Public Schools Health-Related Services webpage. There's a link right in top in terms of reading the district wellness policy. You can go on there. You can offer specific comments, or you can just say, I support the district wellness policy. We want to make sure that the superintendent and Board of Education know that this has broad community support.
Fantastic. All right. Well, thank you so much, Jessica Bauer-Walker and Sherman Webb from Community Health Worker Network of Buffalo. And thanks for all your great work fighting for student wellness in our public schools.
Absolutely.
Thank you.
Everybody over there.
Get on up,
Everybody right there.
get into it,
Everybody right there.
get involved.
Everybody